Yes, thank you very much. You can just stay there because I'll try to be brief, but thank all of you for sticking with us. I know a few people have gone upstairs to prepare for the poster session, and I do want to remind everybody there's a reception and a poster session on the third floor. I was going to take a couple minutes just to summarize what we've said today and maybe give a charge for tomorrow, but also for the future. Couple of phrases have stuck out. We're training people for a world that no longer exists. And everybody nodded when that was said earlier, and you're nodding again. Our health system is not working. I'm preaching to the choir here, but we have the vivid example of Camden and many of our inner cities and many of our rural areas. So the obstacles that we're looking at in terms of trying to make some changes in how health professionals work with communities include the health system itself, and we talked about that at length. Professional silos, and we've talked about that at length. I think one of the issues has been very much how professions have set boundaries, and we've talked about this, Afaf and I, and George is out of the room right now. A few of us were members of the Lancet Commission that published the report on rethinking the health professions. And as we have put that report out around the world, we've run into the silos. People say, well, a nurse couldn't possibly do that, only a doctor could. A midwife couldn't possibly do that, only a nurse could or a doctor could, and so on. The technology is changing so fast that the way we've siloed the health professions is obsolete. And we need to think about that. And we talked a lot today about the need to talk to each other and to work together. We also talked about the problems with the financing and the financial, either it's incentives or disincentives. But I would say the disincentives to go into primary care, to go into community health, to go into pediatrics, and so forth. We also have an obstacle, a huge one, in accreditation and licensing. And this is something we do need to consider. We are talking about it, but what are we going to do about it? In the US, we're very used to the way we do things. One of the things that I think we've learned today is that there's a little more willingness sometimes to experiment, either in communities that are stressed, like Camden or Alaska, as these last two examples, or in countries that are taking a little bit more freedom with experimenting. We also talked about faculty rewards and incentives as being an obstacle. Another phrase I picked up from the conversation today, medicine and healthcare are completely disconnected from the people on the ground. And yes, and we're talking about it. We've got to do more than talk. Here's another phrase I liked, we need more health professionals, but not the same kind. Think about that. Some countries outside the US have more freedom to develop new models. I think part of it is they never totally picked up all our bad habits. Part of it is that they don't have the accrediting bodies and the standards, which I think we very ethnocentrically saw as a big disadvantage. And then listening to the example, particularly from the Philippines today, it may have been an advantage not to have an accrediting body standing over you when you completely changed the model. So we can learn from these. We also, as I listen to us today, we're getting to community, but we're probably, with the exceptions of people who've been with us today, who are really in the trenches in the community, we're not even the best group to talk about how to actually teach getting to the community. And I think we've had some examples today of community members having inputs, community participation. I ran one of the first community participatory research projects. It was actually the first one CDC ever funded in South Central LA, immediately after the Rodney King uprising, which is a riot if you're an outsider and an uprising if you're an insider. And the things that we learned as UCLA, academics from the community were just tremendous. And that the project eventually the advisory board formed a 501c3, that the Healthy African American Families Project, that is still brokering research and healthcare in that community now more than 20 years later. So we need to keep thinking about how we work with communities. As I listened today, I saw that we really have two tasks, if you will, or paths. I wasn't sure which to call them. One is a short-term one, and one is a long-term one. The short-term one is, we've been talking about both, but the short-term one is the, quote, easier one, not easy. We just heard, you despair of changing medical training, and you're right, that's probably part of the long-term. But we can improve the content of current training and education. We talked about a lot of ways of doing that today. One of the things we didn't use the phrase was positive deviance. When you mentioned negative deviance, I thought about the positive deviance and the good examples we have of health professions, education that is doing the right thing. I will say, and we finally have started tackling this a little bit, that there are differences in the health professions on this. And so some of us in the room who've been in behavioral sciences, public health, nursing, dentistry. Dentists have to be really nice to patients to get them in. We've been talking about this for a long time, and we're in many ways ahead of what's been happening in very traditional medical education, and we have not yet won the battle of pushing for a dialogue between these health professional groups. And I was saying today at my university, and I'm the president, I should be able to say, do this. Not how it works. OT and PT don't work well together. Okay, if we can't get those two disciplines working well together, and may just be the personalities at my particular university, but how are we going to get all of these professions we're talking about working together, especially when it's very hierarchical? So one of the short-term things we need to do is figure out how to do that better. And we've also heard talk about systems thinking, social determinants of health, how to infuse our health professions education programs with this. That's the short term. That's the easy work. The long term, some of you have talked about, we got to start over. So I think I would call the long term drastic change. And we have to really rethink accreditation. We have to rethink education. Go back to that first sentence. We're training people for a world that no longer exists. We have to go beyond, and this is an argument some of us had in the Lancet Commission. We didn't want to stop with medicine, public health, and nursing. We wanted to go on not only to the other formal health professions, but as you were discussing for the Philippines, people who were traditional midwives, for example, and traditional healthcare practitioners, and break down those barriers of who can do what, because the technology is going to keep changing, and we might as well forget about the barriers. And then really figuring out, getting the community input on this change. So we have to be leaders on this. I'm preaching to the choir. Everybody in this room, from the conversations we've had, gets this and is thinking about how to do it. But we have to go out there and be policy leaders in our various areas and in our various disciplines on both the short-term change and the long-term change. And I hope tomorrow's conversations will continue ways to do this. I do want to end by thanking everybody who participated today. It's been a wonderful set of discussions. And also particularly to thank Patricia Cuff, Megan, the rest of your staff. There's really, I think, a small cast behind you supporting everything. I see people behind cameras and people at desks. I want to thank everybody. And I want to thank the Planning Committee for the work that they put into this. And of course, Afaf, to thank the forum for coming up with the idea and pushing us to do the planning and to support this session. So thank you, and I look forward to seeing all of you upstairs at the poster session and at the reception.